Hi everyone, it's Dr. Campbell and welcome to another ICD-10 CM chapter-specific coding guidelines review. Guys, we are in chapter 14, and remember there are 21 chapters in the ICD-10 CM tabular list, and not all 21 chapters have guidelines. So chapter 14, diseases of the genital urinary system, code family N00 through N99. So our guidelines here focus 100% on chronic kidney disease. The ICD-10 CM code set classifies chronic kidney disease based on severity, and the severity is designated by stages 1 through 5. So, for example, stage 2, N18.2, is for mild CKD. N18.3 is stage 3, which is moderate. And then stage 4, N18.4, is severe. And then, guys, we have N18.6, which is end-stage renal disease. And this particular code is assigned when the provider states ESRD. Of note, if both a stage of CKD and ESRD are documented, you only are going to assign the code for N18.6. Next up, chronic kidney disease and kidney transplant status. Believe it or not, patients who have undergone kidney transplant may still have some form of CKD because the kidney transplant may not fully restore the kidney function. Therefore, the presence of CKD alone does not constitute a kidney transplant complication. In terms of code assignment, you are going to assign N18 for the stage of the CKD, and then you're going to use Z94.0, which shows kidney transplant status. Of note, if a transplant complication is documented, you're going to take a look at Section 1C, Guideline 19G, for information on coding complications of a kidney transplant. Now, we're just in Section 14, so when I get to Section 19, I will discuss that guideline, but if you need to see that today, go ahead and take a look at that. Now, of course, if the documentation is unclear as to whether or not the patient has complication of a transplant, you'll want to query your provider for clarification. Last guideline, chronic kidney disease with another condition. Patients with CKD may also suffer from other conditions such as diabetes and hypertension. The sequencing of the CKD code in relation to codes for other conditions is based on your tabular list. Something else I want to note is that in your ICD-10 CM alphabetical index, specifically under diabetes and hypertension, pay close attention to the codes that are available, the subterm entries that are available. For example, a patient that has diabetes and CKD, there's actually a code that can help you get the fact that the patient has diabetes and CKD. Same thing, and you still have to report a code for the stage of the CKD, but that code gives you that language. A great example is E11.22, which is type 2 diabetes with CKD. Same thing for hypertension, and guys, we actually went over the guidelines for hypertension and CKD in our chapter 9 review video. All right, guys, that's it for chapter 14. Happy coding. Next up, guys, we have a monster of a section to review, and that's chapter 15, which is pregnancy. Happy coding.